Hello, everyone, and thank you for joining us today for Thrive Health's October 2022 Grand Round Speaker Series. Before diving in and introducing our speaker, I wanted to open with a land acknowledgement. We're hosting this session today from the unceded and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations, and are lucky to have team members and attendees joining from other territories across North America as well. So again, welcome and welcome back. If you've joined us for these sessions before, today's discussion will be on how new technologies are expanding the scope of cancer survivor care across Canada. Just a few housekeeping notes. Please enter questions in the Q&A tab in Zoom. Throughout the session, I'll be monitoring it. And if there are any questions, we'll try to get those in. Also, just to note that we are recording today's session and it's being live streamed on LinkedIn. So without further ado, I will introduce our speaker. We're grateful to be joined today by Dr. Anna Wilkinson, Associate Professor at the University of Ottawa, Department of Family Medicine. Dr. Anna Wilkinson is a family physician with a special interest in oncology. She divides her clinical time between caring for medical oncology in patients and academic family practice, and as an associate professor, program director for the PGY3 FP Oncology Program and the Regional Cancer Primary Care Lead. She's the chair of the Cancer Care Member Interest Group at the College of Family Physicians of Canada, where she authors and edits the Oncology Briefs series in the Canadian Family Physicians Journal. Anna's research interest includes the intersection of cancer care and family medicine, specifically screening, survivorship care, and knowledge translation. And of course, most importantly, in her spare time, she tries to hard to keep up with her 4 teenage athletic daughters. Welcome, Dr. Wilkinson, to our speaker series. So let's start by asking the first question. So what is cancer survivorship care? And so what are some of the current challenges facing this practice across Canada?
That's a big question. So thank you very much for having me. I really appreciate the chance to speak to you. And I understand for sure that many of the people listening, maybe medicine or cancer isn't their world. So maybe today I can shed a little light onto how our system works, our cancer system works, and how technology maybe can kind of dovetail with that.
Sure.
So what is cancer survivorship care? I'm going to break it down to that first of all, because that was a big question. A lot of people think that you have your cancer treatment and you're kind of finished, right? You're done, that's it. But it's so much more than that, right? After you've finished a cancer treatment, whatever kind of cancer you've had, you have to kind of transition from this time of really intense monitoring where that, someone's kind of watching out for things to kind of being out there on your own and maybe not feeling as supported. You've got to adjust to a new reality of life. You may have had surgeries or chemotherapy or radiation treatment that's left you with permanent side effects. You may be feeling different kind of physically, and certainly we know psychologically there's huge impacts post-cancer treatment. A third of cancer survivors suffer from depression or anxiety, so that's much higher than the general population. And there's a big problem with fear of recurrence, right? If you've been through this big intensive treatment, you're always worried on some level that maybe this cancer will come back. Cancer treatment puts people through lots of difficulties in terms of financial difficulties. Lots of people have had to stop working during treatment, and lots of relationships find that the stresses are really difficult to kind of manage. So there's all of that. So cancer care for survivors is really around how do you support the person post-treatment? How do you make sure the cancer is not coming back? And how do you make sure they stay healthy?
Right. I mean, just learning more about the work that you do, I've taken on a whole new appreciation about the different levels of care and support that's required, at a long-term level with patients. And I guess this leads to my next question regarding, so what are some of the gaps that primary care physicians are experiencing today with providing post-cancer care to patients?
So maybe we should backtrack a little bit. So I'll explain kind of how this care usually happens and what the role of a family doc is there. And then you can see where that, so when you finish your cancer treatment, typically you may stay with the cancer center for a while and have kind of periodic assessments. But usually what will happen is that you will be discharged to your family doctor, and your family doctor will be the one who needs to be sort of looking out for you and figuring out what they need to do in terms of watching to make sure that cancer hasn't coming back, watching for long-term side effects of treatment and how to manage them, and even regular things like, are you still having all the health promotion stuff that you would normally have, like, you know, screening for cervical cancer or colon cancer. So typically that care should transition out of the cancer center and into a family physician's office. Because if you think about it, our cancer centers are really busy with treating patients on active chemotherapy and cancer therapy. So to, you know, it makes the most sense to use those spaces for that purpose and not for people who are finished their treatment. But it's not so simple. So family physicians, as you know, first off, we're really low or short on family physicians. I think in our region, it's expected that by the end of, I think, 2024, 1 in 3 people will not have a family physician. So there's a huge barrier, even just in terms of HR and manpower. But I would say one of the biggest hurdles for family physicians is knowledge, really. So this isn't something that family docs are taught about in medical school or residency. So they don't have kind of the knowledge base necessarily that's being updated all the time to manage this. And they've got so many other things to be learning about. They take care of heart disease and diabetes and everything, that their bandwidth is, you know, limited in terms of taking on more information. So, you know, you've got not many family docs, you've got not well supported family docs in terms of the knowledge they need to know. And then I would say the last part is you have a system technologically which really doesn't support these family docs to do what they need to do.
Right. So certainly there is a knowledge gap for these family doctors to provide the right level of support. So I guess just a follow-up question to that, if someone doesn't have a family physician, as you mentioned, there is a shortage of that. So what happens to those patients in terms of what kind of care will they be able to access?
So right now what's happening, certainly, and I'm speaking from an Ontario perspective because that's where I'm from, but I think it's probably the same all over Canada. So sometimes if they're very high risk, those patients are being kept on in the cancer center, which means, again, less room for, you know, patients to come in who need active treatment. But what is often happening is, you know, patients are being discharged and the message to patients is, well, I think you're just going to have to go to a walk-in clinic and find someone to kind of give you the care that you need.
Right.
So
and so, sorry?
It's not ideal at all.
No, absolutely. I can see certainly there must be a high level of frustration for those patients trying to, you know, advocate for themselves to receive care in this process. And I guess, you know, just going back to that initial question around survivorship care. So how long are these care journeys for patients? Like, what is the average time, and is it different for different types of cancer as well?
So typically when we think of cancer survivorship, we think of 5 years, right? 5 years is sort of the highest risk time for recurrence. And so that's when we tend to watch patients most closely. But really, you know, when we look at longer term, when we try and look at survival for breast cancer, we need to look at a 10-year span, because we often see that people recur within those 10 years. And in breast cancer, sometimes people recur up to 20 years post initial diagnosis. So I think, yes, the intense monitoring kind of settles down a little bit, but, you know, there's always a risk of recurrence there, and patients and providers always need to be really attentive to what's going on with these patients.
Right. And I guess, you know, we are now in this era where, you know, a lot of people have access to technology, and we're also seeing, you know, change in healthcare system and the environment itself, especially post-COVID. We've seen a lot of adoption in terms of providing virtual care and being able to see patients, you know, remotely as well. So are you noticing any trends for providing post-cancer care with some of the new technology that we're seeing?
Not yet. So hopefully, so maybe what the care looks like right now, I would say. So typically when a patient is discharged from a cancer center, they have a care plan that's populated. And that care plan talks about the treatment they've had and the surveillance they should have. So for example, if you've had breast cancer, you should have a mammogram yearly and a physical exam every so often, these kinds of things. So what happens currently is that care plan is faxed.
Right.
When I bring up that word, it's like a dirty word in the technology industry, but is typically faxed, or sometimes they can be e-faxed, if you will, to the primary care physician. At that primary care physician's office, they read it, they sign off on it, it gets scanned, and it gets put in their electronic medical record. And so I know for my patients I have who have care plans, they're buried, scan at the bottom of the list of scanned documents. It's not an active document, right? It's a passive thing. So I, as a care provider, then have to remember, oh yeah, that thing that I saw 2 years ago when it came past my desk said this patient needs a mammogram every year. And I have to remember that when that patient is in front of me, when they come in and see me. So I think that's why we know that primary care providers can do just as good a job as cancer centers with survivorship care, but we know that typically, you know, 50% of the time with primary care providers, the right things aren't happening. And I think it's technology based, right? That those prompts aren't coming.
So if I understand it correctly, this package is sent to the family physician if the patient has one, and it includes sort of the steps that the patient needs to be doing over this period of, let's say, 5 years. However, as you mentioned, it's passive. There's no prompts in terms of letting the family physician know now it's time for, let's say, a checkup or an appointment and so forth. And so certainly I can see that there can be a lot of issues in terms of, you know, patients being missed in terms of receiving their appointments at the right time. I guess my question in relation to that is, when a patient is discharged, let's say from the hospital, are they receiving anything regarding this package so that they have something to also navigate through?
Yeah, I mean, the patients typically get that same paper care plan at the same time.
Right.
So they have a copy of it. They know what should be happening when, theoretically, but they're not very patient friendly often. They're more clinician kind of driven.
Right. You mean in terms of the medical language that's used?
The lingo and the treatment. In terms of, I never fully answered your previous question about have the shifts in healthcare technology COVID, have they impacted on any of this? I would say for sure we've seen that COVID has pushed us light years ahead of, in terms of things like virtual care and, you know, care over Zoom and telephone. I haven't seen that play into survivorship care at this point. And I think people got more comfortable doing things virtually. I think people got more comfortable with apps like the COVID apps, those kinds of things. So I think there's a greater openness and acceptance of this way of doing things. I think it's moved things forward that way, but I don't think it's changed care at the moment.
Right. And I guess if in terms of volume, how many patients are affected by, you know, I know it's an open-ended question in some ways, but in terms of the types of patients that you see at the hospital, are we talking about a really large volume of patients coming in to receive treatment? And is there a large pool of patients that are on these survivorship care plans as well?
So to put this all in context, and I'm going to use breast cancer because that's what I'm most familiar with a lot of the numbers for, but every year in Canada, there's 29,000 women diagnosed with breast cancer. That's every single year. And the women who have stage 1 breast cancer, so very early stage breast cancer, have a survival of 99.8% over 5 years. Stage 2 is around 97%. So you've got tens of thousands of women in cancer. This is just one cancer, right? In each year, who are then, after they go through their treatment, they're sort of graduating into their survivorship phase of things. There's the other common cancers wouldn't be quite as many cases, but on par. So that would be things like colon cancer, prostate cancer, lung cancer. So certainly we're talking thousands of patients for sure.
Right. And so, just recognizing that there is a large volume of patients that are being diagnosed with cancer and need to go through treatment and post-cancer care or treatment care, how do you think current and future technologies could help improve and support survivorship care?
And I'm going to back up for 1 second. I would say one of the reasons that there are so many survivors is because we're getting good at treating cancer, right? Which is a good thing. Like the fact that we're having this conversation at all is a really good thing. And I don't want to lose that in all of this.
Absolutely.
Because, with immunotherapy, we're now seeing long-term survival in patients who had stage 4 metastatic lung cancer, and same with melanoma, right? So there's a real shift in the way that we've learned how to treat patients, and so there's more survivors as a result. In terms of how we can use technology, I think we have to kind of turn everything on its head if we want to think about our crumbling healthcare system and how we kind of make it work. I think we have to think differently than we have before, because we are not going to have the capacity to support all these patients necessarily, right? We can't train that many more family physicians or NPs or nurses in such a short time frame. So we have to be creative at this point. The Canadian Partnership Against Cancer, they did a big study to look at survivorship care and what we should be looking at. And they called for a digital solution. And they thought that would increase capacity, improve communication, and allow patients to institute self-management strategies. So I like that view. And I think this is where Thrive is so effective, right? Is in bringing in that digital transformation. So I think we need to think less about, pushing care plans to doctors and maybe more about empowering patients. And how do we teach patients what they need to know, what they need to be doing, how patients can advocate for themselves better. I think we need to shift views a little bit. And I think if we properly support patients, so I'm certainly not advocating that we take care away from patients. I'm advocating that we do it differently.
Yeah, no, absolutely. I mean, certainly there is an interesting role that technology can play, and we're starting to see some questions come in actually, which tie into that. So maybe I'll start with the first one. So do you think all cancers lend themselves to a digital survivorship platform, or do you think that only certain types of cancers can benefit from the technology?
So I think for sure all cancers do. Now, when you think about survivorship care, there's basically, you have to think of it in 4 spheres. So you have to know your patient and know the treatment they've had. You have to be surveilling for disease recurrence, so making sure the cancer is not coming back. And that means the patient has to know what symptoms they might be looking for and what investigations they need to do. You need to be looking for long-term side effects from treatment and how to manage those and linking patients with resources on those. And finally, you need to be looking at health promotion, because things like exercise and healthy eating are going to prevent, if patients have developed one cancer, they're often at risk for developing another. And by sometimes changing those lifestyle things or having other cancer screening, they may prevent those. So that framework is the same for every kind of cancer. Obviously, there's some cancers that have more survivors than others, and there's some very unusual cancers that maybe wouldn't fit as much a sort of a digital platform to lots of people, but I think it's almost like a plug and play. Like if you have your 4 stages and you can kind of pull out, okay, for lung cancer, the investigations you need to make sure it hasn't recurred are this. And instead of a mammogram, maybe you do a chest x-ray or a CT, but the framework is all the same.
Right. And certainly, I think potentially what the technology can enable is providing, first of all, self-management strategies for patients to be able to learn more about, you know, the treatment and what they need to do for themselves, but also a bit of a personalization, right? As they're going through this.
So I would say a couple of things there. So for breast cancer recurrences, 88% of cases had symptoms. So when patients recurred, there were symptoms there. So if a patient, and one study I was reading over was suggesting that when there was a scheduled appointment, the patient would actually, even though they had the symptoms, they'd wait for that appointment because they knew that they had the appointment and they didn't want to kind of. So if a patient is educated enough that they know, okay, I'm looking out for these symptoms. If I see these, I know I have to get in touch with someone.
Right.
Then that's going to be really effective. In terms of your other question, the individualization, absolutely. So that's where that first stage of our sphere of know your patient. So depending on the treatment you had, you're going to have different toxicities. You're going to have different side effects. And so if you plug, you know, not every breast cancer patient is the same. Some of them may have had chemo, some may not. Some may have radiation or not. So you can plug that in. And for that individual person, they would know what things they should be watching out for.
Right. We have another question. So what are some of the barriers or risks maybe in implementing self-management app?
I think you have to be very careful with a self-management app that you have adequate ability or resources for a patient to seek attention if they do have one of those red flags coming. So you need to know, A, that the patients are kind of following along and doing the things they're supposed to be doing. So they're doing, say, a monthly self-breast exam, or they're doing a recurrence screen. And then you need to know if that red flag comes up, are they seeking medical attention?
Right. 2 more questions for you. So how does a digital app improve equity for people?
That's an interesting question. I think current survivorship care is very much predicated on patients being their own advocates. So as I sort of explained with that static care plan in my electronic medical record, you know, you almost need that patient coming in and saying, hey, is it time for my mammogram yet? And if you have patients who are not as self-aware or motivated, if you have patients who have jobs where they can't leave and so they can't go see their physician to ask for those investigations, you're creating a barrier there. And so I think we know that patients who are definitely rural, lower socioeconomic status, and often if patients are sort of different ethnicities, the rate of mammograms is not as high as patients who are sort of educated urban dwellers. And so there is for sure, even the way things are structured now, you're very much set up that you're seeing 2 realities in terms of survivorship care. So I think with the app, if survivorship care was digitally based, all patients would get exactly the same information. And if they're being prompted, all patients would be made aware of, okay, I need to think about doing my breast exam or doing this screen for recurrence. So I think you're leveling the playing field a little bit.
Yeah, no, certainly I can see that there's possibilities for providing that consistent level of care to all types of patients within, you know, an area, even if they're in remote regions where they have limited access to, you know, going to a clinic, for example. We have a few more questions for you. So maybe this is a 2-part question. So would it be accurate to state that cancer patients typically are an older age demographic? it is also safe to assume that the older the demographic is, the more adverse this group is to using technology such as a digital solution. If this is true, how can you educate, communicate, and promote the use and adoption?
Yeah, I think when we talk about trying to make sure care is equitable, making sure that technology access is uniform is a big part of that. Certainly, older ages have been less prone to adapt technology. I think that COVID, harkens back to that earlier question of COVID. I think that has really accelerated or helped with this, because I think, you know, the number of grandparents who hopped on Zoom during COVID when they never ever would have imagined doing that before. I think there's a greater acceptance.
Right.
And I would say that although many cancers happen in older patients, you know, 1 in 5 breast cancers happens into a woman in her 40s, right? So there is a younger demographic as well. But I agree, it's something that you'd have to be very careful with, that you're getting equal access for older and younger. I guess the other thing you could do to help with this is if you could allow a caregiver, like a family member could be sort of a co-user and help navigate for the older person. That would be one way around that as well.
Interestingly, we just had a question that I think aligns with what you just mentioned. Maybe I'll ask this first before we look at the other two. Do you know if what percentage of cancer survivors have their survivorship care managed by a caregiver, like a parent or children as well?
I don't know a number. Certainly just anecdotally from thinking about the clinic or the patients I see. Yes, certainly as patients get older, there tend to be more children involved, but that tends to be more when they're sort of set in the 70s or 80s.
Right. I can also envision that if there is a tool that allows for this, for patients to manage their care, that they may be able to have their family members collaborate on the platform itself to be able to manage that. So again, that helps that binding of relationships. So I guess we'll go and jump into these two other questions. So what's the best way for a cancer survivor who doesn't have a family physician to talk about their risks with a physician who doesn't know their history? Could a self-management application help with this?
Absolutely. I think if you don't have a family physician as a cancer survivor, and you need to talk through your risks, I would imagine that you also could have done that through your cancer treatment as well with your oncologist. I think digital survivorship tool would mostly support sort of the known cancer, but part of what we're trying to look at doing for breast in the intake looks at risk for other things and whether you need screening for genetics or that kind of thing. So I think you can build those kinds of sort of general screens into a digital tool.
Yeah, and certainly I think if, let's say, using a digital solution, if a patient is able to have, the assessments and things that they're sort of going through made available to them, potentially they can share that with, a doctor that's not necessarily their family physician. So again, maybe there is that opportunity to, inform the doctor in terms of their condition and history as well over time. So we'll go to our next question. So from your experience, how receptive would patients be to using digital tech for survivorship care support?
It's interesting because we floated this idea in our patient and family advisory council. So at the Cancer Center, we have a group of patients and family who've been through treatment who help advise us on the way that the Cancer Center should be running. And so we floated this idea and there was such overwhelming excitement. I have 2 or 3 people lined up who are so keen to kind of look at any kind of tool that's developed. But I think patients are really keen to be empowered, right? Patients are smart. And if we don't give them good information, they're going to go to Dr. Google. And the information you get from Dr. Google isn't always the best information, right? So if we can give them trusted, validated information. And if we know that there's resources within a digital survivorship tool that help them manage some of these toxicities. So, you know, if you have neuropathy, here's where you should go. If you've got depression, here's some good websites. If you're wondering about what you should be doing for healthy kind of eating and diet and exercise, here's some really good resources. So if you can have all those things within a tool, you can really support patients. So I think they're really, really key.
Well, that's exciting to hear. And I think, you know, there's opportunities again, you know, through that education model to almost implement a preventative approach as well for potentially reoccurrence. You know, if patients are able to catch certain symptoms at the right time and be able to have that conversation with their family doctor, potentially mitigate additional risks. And I guess
I'm going to say just for 2 seconds, the earlier you catch a recurrence, the better, right? So we know with any cancer, the earlier stage it's caught at, the more easily treatable it is. So if a sort of periodic recurrence tool or patient reported outcome measure or screen is going to catch those cancers earlier, I think you would have better outcomes overall.
All right. Well, and I think actually this next question that came up kind of ties maybe to a bit of this conversation we're just having right now, which is, do you believe there will ever be a cure for breast cancer or cancer overall? Diagnoses and treatment are so important, but what are your thoughts if a cure will ever be possible?
I mean, cancer is such a broad word. It represents thousands of different diseases, and breast cancer in and of itself represents there's many different kinds of breast cancer. I think we've really advanced our treatments. I don't know if cure is the right word to be using, but certainly with things like immunotherapy that have come in with melanoma and lung cancers, we're treating cancers with long-term survival that we would have seen patients survive for months before. So there's big advances that have been made. I'm reluctant to use the word cure. That's a big word.
Right. And I guess that just maybe it might still be on the same topic. You know, we've been talking about post-treatment care and how technology can, you know, support that. But I'm wondering if there's also opportunity for technology to be used during the initial phase of, let's say, a referral has come in, and then supporting that triage process to potentially make it easier for, you know, clinicians to know what should be the next level of care for the patient. Do you see an opportunity there as well?
Yeah, I mean, there's to really know how to treat a cancer, you have to have a lot of information and you have to have it all there. And so streamlining those processes will always lead to better outcomes. We know the diagnostic interval is the time between when a patient comes with symptoms to when they're seeing a specialist and starting treatment. And so if we can shrink that interval down, we can improve outcomes. We know that much. There's one study that shows with lung cancer, if you have a stage 3 lung cancer, which is a higher risk lung cancer, if there's a delay of 30 days in starting your treatment, that your chance of having incurable disease rises by about 50%. So time really matters. And so anything that can expedite that move on to treatment would be a positive.
So certainly, we have another question, but so certainly there is an opportunity to sort of have more of a comprehensive way of, you know, triaging to providing that post-cancer care for patients, using, again, leveraging that technology to be able to collect that information at the right time and provide it accurately to the right people at the right time as well. So we have another question. How effective is a self-management plan if it isn't customized or personalized to the patient, given how different cancers are? There's a couple of other components to this question. So that's the first part. And then what level is best? For example, type of cancer, stage of cancer, age, etc.
So I think this kind of goes back again to those 4 spheres of survivorship care, right? So the first one is know your patient, and then disease-specific surveillance, long-term toxicities, and health promotion. So I would say there are many commonalities there that are the same no matter what the cancer is. Certainly, in terms of the health promotion stuff, that's the same no matter what. And I would say a lot of the psychological toxicities, which are some of the most prevalent issues that cancer survivors have, are the same no matter what the cancer is. So those really high rates of depression, anxiety, fear of recurrence, how to return to work, those kinds of things, those are commonalities. That's a common denominator for all cancers.
Right.
I think in terms of customizing for stage, I don't think that's as critical. Although we do appreciate that if a cancer is a higher stage or more advanced, that the risk of recurrence is that much greater. So maybe if a cancer is a higher stage, you might be screening for recurrence more frequently, say, but it would still be the same screen as if it was a lower stage. I can't remember what other parts of that question there were there, but I think we sort of covered most of it.
Yeah, I mean, I guess the second question, which I believe you answered, was at what level is best in terms of, stage of cancer or age?
I think personalized care is always best. And I think that has to be personalized based on the treatment that people have had. I don't think age plays into it. The risk of recurrence is, I don't think the age is going to change that too much.
Right. And I guess in terms of, you mentioned around the mental well-being, patients may experience depression. I'm wondering if there's opportunities to also provide education to family members in terms of providing support. I know we talked earlier about, if a patient that's of older age, that they can have a caregiver or their children supporting. But I think that kind of speaks to almost everybody, where kind of want that circle of support to know your condition and being able to support you through that journey. Is that correct?
Yeah, I mean, I think a lot of people think that when your cancer's done, you're done. And I don't know that families and people appreciate the high levels of stress and anxiety that moving forward often has for patients. The issues in figuring out how to go back to work, how to go back to normal life. I think all of those things are, families inherently involved in these. And so for families to understand, okay, it's all the treatment's done, but now we're going to have to look at these things is probably really helpful.
We have a question on reoccurrence. So what is the percentage of reoccurrence? And has this percentage been reduced over time?
So recurrence, again, this varies from cancer to cancer, and even within breast cancer is going to vary if you have a very advanced breast cancer or an early breast cancer. But typically, the numbers I've read are up to 40% of patients may recur over a 20-year time frame for breast cancer. Certainly, if patients are stage 3 breast cancer, their 5-year survival is about 72%, I believe. So, these patients, even though they've been treated, many of them are going to recur very quickly, because a quarter of them are not going to make it through those 5 years, right?
Right. And just a question around, so let's say we're using digital technology to support patients with their survivorship care. Do you also see an opportunity where there could be research projects around, the impact of survivorship care, where we can then monitor, what are some of the ways that we can improve or provide strategies to patients? Do you see any usability there in terms of a research component to this?
Absolutely. I think one of the cool things about using a digital platform for survivorship care is it collects data for you, right? So know how many people had symptoms and then recurred. Because right now we sort of try and track that retrospectively, and it's very difficult to track that.
Right.
How many people are finding things on exam? How many people are finding that they have depression or anxiety, right? You would actually know that from tracking what's coming back from the app. The other thing I think that would be really helpful would be we were looking at a group in Denmark where they use a patient-reported outcome measure, so a PROM, to look at disease recurrence. So a set of questions that predicts whether your diseases come back. And so if you were using that PROM and you could figure out who actually recurred, you would learn pretty quickly, is that a good measure, and is that something we should be using to find cases more quickly?
Great. We have one more question. In your opinion, what are the top solvable problems in survivorship care?
I like to think that the biggest solvable problem in survivorship care is technology, right? I think if we can move away from faxes and these archaic documents that are sort of filed and never looked at, and if we can move to an active, engaged, empowered future where patients are prompted, and ideally, ultimately, primary care providers are prompted even to order things. I think that would be the biggest thing we could solve, because it would educate primary care providers at the same time as improving care.
And I guess just adding to that a little bit in terms of just as a follow-up question. So, we talked about patients being able to access self-management, evidence-based educational materials. They're able to, monitor their symptoms. Are there any other things that you see that would be valuable that we can leverage technology for to enhance this survivorship care model?
I think, well, you mentioned resources, right? I think that's key, to have kind of a library of really good resources. I think teaching patients what to look for is also one of the biggest things, and teaching them things like how to do a safer breast, how to do a self-breast exam, so that patients are monitoring themselves and learning how to do it properly.
Right. And just going back, I guess, to our earlier conversation around how this package is passive when it's received by the family doctor, I guess, for the patient to receive reminders around appointment management and when to see, because these can be like 6 months from now or maybe a year from now. So who's going to be able to remember that? So perhaps the technology can help patients be reminded of those important appointments, correct?
Absolutely. Yeah.
Perfect. Well, we have 1 minute left. I'm not sure if there are any more questions from our group. Maybe I'll give folks another 5 seconds or so, but it's been certainly an enlightening conversation. I'm sure there is many more things we can talk about around survivorship care. We thank you for your time, Dr. Wilkinson. And we thank our audience for attending today's session. So thank you, everyone, and have a wonderful Friday afternoon.
Thanks very much for having me.
Take care. Bye-bye.